I think before we get to this STEAM panel, I think we all know the facts. There are nearly 7,000 known rare diseases affecting almost 1 in 10 Americans, so many of whom are children, but only 5% of rare diseases have an FDA-approved treatment. Those are the numbers, but what really matters are the people. And I don't think you're just here for the numbers. You're here because you've had a rare disease, you have a family member, a friend, with a rare disease, and you make a difference when you go around and talk to the members of Congress and your advocates as well. And I think that we know that this goes beyond simply keeping members informed of federal policies and procedures. As we rightly focus on evidence-based medicine, sometimes we lose sight of the human experience of these diseases and different therapies. What may seem simple in a lab may be overwhelming or difficult when applied to real patients, as you all know. And that's why we've worked so hard to speed up some of these approvals and to move these agencies to really see what people's lives are like, and no one can do that better than all of you. Now, you know there's an old saying in medicine that you probably heard: when you hear hoofbeats, think of horses, not zebras. But the fact is that we know that all hoofbeats are not horses. They are often zebras. Zebras live among us, and they deserve accurate diagnosis and the treatment they need to live happy, healthy lives. And I know I can just tell you from a state that believes in medicine, the home of the University of Minnesota and the Mayo Clinic, and the home of, we like to say in the words of Garrison Keillor, we're a state where the women are strong, the men are good looking, and all the doctors are above average. So we believe that you can do incredible things with medicine, and you can do innovative things. We brought the world everything in Minnesota, from the pacemaker, which was made in our state and invented in our state, to the Post-it note, also invented in our state. And that science matters. So I want to thank all of you for your advocacy, and we look forward to seeing you in the halls of Congress, and just keep up the good work. You already made tremendous difference with the Cures Act, and so let's move this even further along. Thank you, everyone.